everybody. Welcome to Modern Aging. Today we have Dr. Shoshana Ungerleider live with us. So thank you so much. You're here from San Francisco, right?
Yes, thank you for having me.
You're an internist, and you've been dealing with a lot of questions, I believe, on COVID in the last few weeks, mainly through telemedicine.
Mainly through telemedicine, and then also I've been doing some Instagram stories just for the people that want to tune in on Instagram, and people ask me questions and similar to this, and I sort of do a live or a video response on my Instagram stories. So yes, doing a lot of medicine right now.
That's great. So I'll actually put that in the description below after this interview is over with your Instagram handle. Well, first of all, thank you so much, because this is a time where we're leaning on healthcare workers so much. There's a lot of unknowns and a lot of fear. And so I'm hoping that this conversation will help appease people's fears. So first off, we were talking a little bit because my husband and my daughter have started showing symptoms, but we can't get them tested. So we don't know. But we're just assuming and taking all the precautions as though they do have it, whether or not they have it. It could just be kind of a bad cold / slight flu or something like that. They do have mild symptoms. But in that case, what do you recommend?
Yeah, so I think my first sort of general medical disclaimer that yes, I am a doctor and I can answer really general questions about COVID and what we know based on science and data. I, of course, want to make sure people know that this does not substitute for medical advice. If you are in a medical emergency or need help, you can call your doctor, you can call 911 if it's an emergency, or go to the nearest emergency room. So thank you for that sharing your personal experience around this. I'm sorry to hear that your kiddo and your husband are sick. I think it's totally the case that across the country there are not enough tests. Even people who are very sick and even in the hospital are having a hard time getting tested and getting results back in a timely manner. And that's something that is being worked on. We're being told that in the coming weeks we will have more testing capability and faster tests. Gosh, I'm so hoping that that's the case, because I think that that's one of the keys to really figuring this out for people, is knowing the extent of illness and allowing people who are sick to continue to self-isolate. Right now, in general, if you're not feeling well, of course, contact your doctor. But we are recommending that a lot of people stay home across the country, whether you're sick or not, right? That this whole thing around self-isolation and staying home is the way that we can flatten the curve such that we don't overwhelm the healthcare system to such a degree. And I think it's also important for people to know that it's March. It's very typical for other colds and flu bugs out there to be causing symptoms for people. So the general kind of common colds and flu and other things are still happening. And so, while you may have symptoms, it could be something else. That said, it's really important that we're all really diligent about hand washing, about social distancing, meaning staying 6 feet away from people, and honestly, right now, staying home as much as you possibly can.
Right. And I think that even within our own family, it's about not panicking, right? Just because they're showing some flu symptoms doesn't mean they're going to die, or, and I think that people are just going crazy because they're watching too much news or whatever it may be. I do have somebody asking that does COVID affect vision? I have not heard that.
Not that I know of. I have not heard about COVID-19 causing vision problems. That said, goodness, if you're having vision problems, that's important to recognize and call your doctor.
But you did mention before the call about taste and smell now could possibly.
Yeah, there's some early data out of Europe that was reported on, in the national news over the last couple of days, that they are seeing a correlation between people losing their sense of taste and their sense of smell, which is also called anosmia. in the setting of COVID-19. And so some of my patients that I've talked to have reported that they've lost their sense of taste and smell, and we think that is in fact correlated with COVID-19 infection.
Wow. Have you heard any reports so if you do get COVID or if you get some sort of infection, that you will be immune?
Yeah. The immunity question is really interesting. So early on, from reports from China, there were what we think to be cases of people being reinfected, or a few weeks after recovering from COVID, getting it again. It's not clear if it was truly a reinfection, or if it was just that the person wasn't fully recovered and their same symptoms came back. We do think that this virus does mutate like many other viruses do, and therefore there's potential that if you were exposed to one strain, that if it then mutates, you're exposed to another strain, that it can evade your body's immune response. We just don't know. So those are the things that really smart scientists and researchers are testing right now and looking at. And one of the big key factors in kind of knowing more about how this virus behaves is getting more tests out there to be able to know who's sick and actively infected, and then also getting an antibody test. So that's a test that is able to see if you were ever infected. I think in the coming months, my hope is that a lot more will happen in this arena. We'll be getting those tests out and learning a whole lot more about it, so we can better understand it and prevent this future.
Oh no. Oh, okay. I think you're back. You got
Okay.
stuck there. Okay. So are you looking at? I'm assuming most doctors or most of the science community is looking at Italy and China right now, or maybe even Korea and Singapore, people who have done it and been able to kind of smash that curve. Is there any kind of indicators that you've been looking at, kind of seeing, or that you feel, or people that are talking about what the U.S. trajectory is going to be? Whether are we going to be another Italy, or I know it's so day by day, but.
Well, and that's really the key, is that it is day by day, and it matters so much the current response of our state and federal government in terms of their regulations around this, and then how the American public behaves. I think we absolutely have the opportunity to massively flatten the curve and change the future of what happens in our country. And it's a matter of people listening, taking this very, very seriously, and staying home. So self-isolation, as terrible as it is, to not get to see your loved ones and your friends, and get out there and be out in the world. It's really the only thing that we can do. And the stricter that we are, the better results that we're going to have in terms of not having this massive spike of illness and death take over our healthcare system. And I think that countries like China and South Korea that were very, very aggressive around mitigation techniques and then isolation, I think have done a good job. I don't know that will happen in the U.S. We sort of obviously have a lot of different cultural factors and ways that we think about freedom in this country that probably wouldn't jive with that
technique.
That specific technique. But I think we can learn from elements of what they've done, and hopefully not end up in a situation like what's going on in Italy. Although day by day our cases are doubling, death rates are going up and up, and I'm very, very concerned about the future. That said, we still have time to do what science believes is the right thing, which is to self-isolate, take this extremely seriously. This is not just the flu. This is a much more deadly and contagious illness. And everybody really needs to do their part here.
Exactly. Exactly. I mean, it's crazy to me that people are still running around outside. But so there's a question. How do we know, like, what numbers are we looking at to know that the pandemic is actually tapering off and that we've kind of gotten over the hump? Are there some specific numbers you're looking at? Is it death numbers coming down, or is it the new cases?
I don't think we're there yet. I think
Right.
it's very much continuing to spread. Major, continents are, showing that this is continuing to spread like wildfire, unfortunately, and especially as the third world, who largely will be unable to do a lot of containment efforts. I think this will continue there. I think we look at overall cases, we look at new cases, and then deaths and recoveries from it. There's a few websites that are great that are tracking that worldwide. But we're definitely not over the hump. We got a long way to go here.
But in terms of the numbers that you're looking at, so we're just looking, not just, but looking at the number of deaths going down and the number, or is it more important that the number of new cases goes down? But that's going to go up if there's new testing, right? If there's more testing. So
Yeah, so it's a little bit tricky. There's a whole lot of variables. The World Health Organization obviously is expert at looking at epidemics, and of course, this being a pandemic, and citing the data and looking at the right variables, as is within our country the CDC. So I always recommend that folks look to them to sort of know how we're doing on things. But the death rates are not going down; they're going up. New cases are going up, especially in the U.S. Countries like China have seen a sort of a pause, I think, in new cases because of the very aggressive efforts that they did. The question then, will there be a second wave as these restrictions become more lax and people go back to life as usual? Will then the infection rates pick up again? And is there some seasonal component to this? Meaning, right, come summer, when it's warmer and more humid, will the virus not tolerate that environment quite as well? But then come fall and winter, will it pick up again? We honestly have no idea.
Well, I see that there's now cases in Mexico, which makes me feel like seasonal differences doesn't make a difference. But I wanted to ask you about the whole ibuprofen controversy, or I guess question that people have been having. I believe the news first came out of France, where they had recommended not to use it, and now they're saying it's okay to use it. Is that right?
Yeah, so the whole Advil or ibuprofen question is really tricky, and I'm even seeing conflicting reports about that. I think there may be some correlation between the use of Advil or ibuprofen and for people who are COVID positive, in terms of having a more serious illness or what we call like an adverse effect from taking ibuprofen in the setting of COVID. I think, if you're feeling well and healthy and have had, presumably no exposure to COVID, I think it's fine to continue to use ibuprofen. That said, of course, I don't want this to substitute for medical advice. And so if you're having pain symptoms or think that you might be sick, for sure, call your doctor or seek urgent medical attention. But, it's at this point, the last that I saw is the World Health Organization was indicated in a report that that it was okay to continue using ibuprofen. But one way to safeguard against it would be to just say, if I'm having some neck pain or a little fever, take Tylenol instead, and avoid ibuprofen altogether until we have a better sense of this. But again, if you are having symptoms, I would recommend that people seek medical attention, talk to their doctor directly.
Great. I'm not sure if you can answer this question, but I don't know if there's any sense of advice that you could give to people who are suffering from anxiety over the potential of possibly getting this disease, or any of their loved ones getting this awful virus.
Yeah. Well, I mean, this is definitely an extreme moment in time. There are, so many people dealing with daily fear and anxiety around this. And I think that that's completely normal. And so I first, want to say that, I've seen a lot of resources out there for people to get assistance. So free assistance with like group therapy, things where people can connect with one another virtually and just talk about how they're doing. I think now more than ever, we need to be reaching out to the people that we love, our friends, our family, and just checking in, saying, how are you doing? What's happening for you today? And spending time doing that. And I think it's really nice that FaceTime or video chat is available, because it's to me a much more a deeper kind of conversation when you can see someone's face and their reactions back. I think that everybody is feeling like this is just an incredibly stressful time for so many reasons. And so I think that now more than ever, we need to come together, as a country, and think about what that means for us, and really being kind to one another, and recognizing that we're all really, in this together.
That's awesome. No, it's so true. It's so true. So I feel like now that we've been in this for a few weeks, there's a lot of misinformation. There's a lot of information flying everywhere on social media and stuff. Are there certain sites or certain organizations that you recommend that people go to get the real information, right? And be able to decipher that between whatever is rumor?
Yeah, great question. I mean, my go-tos are the World Health Organization website, as well as the CDC. So in terms of knowing kind of what the rules and regulations are, the latest data, the CDC is trying to update their website, every day or two. Yeah, I mean, I would say that's absolutely true, that it is hard to find, trickier than ever. What I would say is when you read something, whether it's on social media or on a news publication site, I mean, you can always look for who the person is that's reporting it, or if they are citing an actual scientist or researcher or a doctor, and look up that person just to make sure that that they're a credible source. I think that's really important. And yeah, it's definitely an odd time with, news and information is just overflowing, and it's hard to get away from, for sure.
I mean, I've heard things from like drink warm drinks every minute or something like that down your throat, so that it doesn't, I don't know. So that your throat the mucus doesn't harden and then go into your lungs. And I don't know if that's still, I mean, so now here I am drinking tea all the time, and I'm like, I don't know.
I haven't heard that myself. I think it's very reasonable to stay hydrated right now, but having tea or water or other drinks is a good idea no matter what's going on. Right. But I'm not sure that there's any science around that recommendation of drinking lots and lots of fluids.
I figured it couldn't help, right? I mean, it couldn't hurt, rather.
Right.
So the reality is there's also a lot of people who don't have insurance, also do not have a doctor. If they start to come down with symptoms, do they just go to urgent care? I mean, is there, there's quite a number of people who are like that, and people who've actually been reaching out to me, and they don't have a doctor to even call.
Right. Well, I think that a couple of things. If you do need medical attention, the best thing would be to call ahead. Most clinics, urgent care centers are asking that everybody give a call ahead to explain what's going on, and then they will determine whether it makes sense for you to be seen in person. Of course, if you're experiencing a medical emergency and you need emergency medical attention, call 911 or go to your nearest emergency room. There's also the continued use of telemedicine, meaning medical care over the telephone or through video chat. So there's various platforms out there that even if you don't have insurance, you can see a doctor, or virtually see a doctor and get medical advice. And the use of telemedicine now has gone way, way, way up in the last few weeks. because many people are trying to stay away from clinics and just ask kind of triage level questions of doctors over the phone.
So we have a question. So should we prepare for a second surge after the virus dies down? And how should we prepare, once our communities become active again? Is there certain things that we should kind of be, I guess, thinking ahead now that we've gone through this experience and trying not to have, lockdowns again? I don't know if there's anything that we can do, or how communities...
Is a question specifically about a second wave of the virus coming?
Right.
Or you're asking about... Yeah, we don't know if that's going to be the case. It's not clear because because this is a brand new virus that human beings have never seen before. We don't have the data to go on to look back at history in terms of how it behaves. I hope that there isn't a second wave. Many scientists and researchers think that there may be, and to be thoughtful and planning ahead for that. The good things is that scientists and researchers are coming up with various treatments that are being tested, as well as hopefully a vaccine for this. Those won't be ready for another year to maybe 18 months because they have to go through pretty rigorous testing to make sure they're safe and effective. But those are positive things on the horizon. And in terms of what's going to happen come fall or winter, we'll see. Yeah. I think right now, continuing to focus on the day to day and doing what you can to stay safe and well is the best thing to do right now.
I have another question here. So looking forward, you're clearly on the front lines talking to patients directly on a daily basis right now. Where are any changes you may want to see within our healthcare system to better prepare for a potential future pandemic?
So the question is where...
Are there any changes that you'd want to see within the healthcare system, things that you see are working? I know, overhaul the whole thing. No. But are there any things that you're seeing now that we could do better, I guess?
Oh my goodness.
Yeah,
where to even start with that? I think that we already knew the healthcare system was fragmented and really quite broken. I think this crisis is showing that in a very condensed way over a very short period of time, where we're seeing that our lack of ability to test and track, and for health systems to talk to one another, and for people to get access to care, all those things are not in place. And it's going to be honestly horrific what's to come with this. I do think that everyone is learning a lot. We were not prepared for a global pandemic, for things that many people assumed was going to happen in the future. We have not been prepared to handle that, from lack of protective equipment to not enough ventilators. To lack of testing. I think that we will absolutely learn for when the next pandemic comes. We will be much more prepared. It will come at a huge cost. And it already has, both, of people's lives and as well as money. But we will learn from this experience and get better.
Do you know if, I'm assuming they are, but working on a test for antibodies? Clearly for coronavirus, but yes, they are. They are working on a test, and an antibody is the body's immune response to when it has seen a pathogen, and in this case, the COVID-19 or the coronavirus rather. So yes, it is something that they are working on, and it's very important actually for us to have a sense of just how many people were exposed and recovered from the illness, in terms of modeling out, the extent of illness and the like. Do you know, is that something that takes as long as a vaccine to develop a vaccine? Is that 12, 18 months down the line as well?
Great question. I don't know the answer to that. I think we're definitely months and months away from that being ready for prime time. I don't know if it'll be quite as long as what we're projecting for vaccines.
It's crazy because, of course, there's going to be so many people who will have had it and recovered. who will still have to self-isolate. And I guess, the economic ramifications of all this is kind of harrowing, but that's a whole other thing.
Yeah.
So another question, so is it best for at-risk people like the elderly to keep wearing masks and gloves even after the pandemic slows down just to be safe? And for how long?
Yeah, so I want to answer that mask question. So it's actually not safe for the public to be wearing masks. So it's not helpful, frankly. If you are trying to avoid infection from COVID-19 and you have to leave your house, stay 6 feet away from people. That's the best thing that you can do, 6 feet or more, hopefully more, away from other people to avoid those droplets coming into contact with your eyes or your nose or your mouth. And of course, also stay away from surfaces. And if you have to touch anything, make sure to wash your hands with soap and water for 20 seconds afterwards. But no, actually, wearing masks can be harmful. It really only is helpful if you happen to have a cough or nasal symptoms and you're around in close proximity to people in your house, maybe, where you're trying to keep them from being exposed to those droplets. But in terms of being out in public and trying to prevent yourself from becoming ill, there's no reason to wear a mask. It actually will not help. And really, we should be saving our masks for our frontline healthcare workers who currently don't have enough of them to go around. They're actively seeing patients without any protection. And wearing gloves is fine. You can get latex gloves if you need to. Another concern around that is don't hoard them because the healthcare system needs gloves. They're touching exposed surfaces all the time, taking care of sick patients, and they need to be able to protect themselves. The best thing you can do, honestly, if you have to be out and touching things, is to wash your hands right away with soap and water for 20 seconds on soap and water. Using alcohol-based hand sanitizer is the next best thing.
Right. Sorry, your audio kind of went. So that's yes, washing your hands, soap and water, 20 seconds at least, right? Better if it's 30 or
right.
more.
Right.
Right. Okay. So do you happen to know how long the antibodies stay present in the bloodstream?
No, I don't know that. I don't know that anyone knows that. That's something that's being tested at this point. When this question of whether or not someone can be reinfected is one that's really important for us to know how long immunity lasts for. Meaning, what is the antibody response? These are all things that scientists and researchers right now are trying to better understand.
And another question. So how long do people keep taking precautions after the virus dies down?
Hard to say. You mean in terms of in general with self-isolation and social distancing?
Well, actually, a good example is my daughter, right? So she had it, it'll be 2 weeks on Thursday, right? So I've just kind of been staying away from her, even though physically she's been better for the last week. She had it, basically 5 days, but I feel like just in case we haven't been sharing dishes or flatware or touching each other or, I'd let her stay in her room. I don't know if I'm going overboard, but.
The current understanding is that once people are no longer exhibiting symptoms, that they feel well, that they are no longer contagious, meaning they can't spread the virus. That said, without knowing for sure that that's what she had,
right.
It's a little bit hard to say. But I think that it's a confusing time because what we do know is that a lot of people are infected, do not exhibit any symptoms, right, and then are spreading this virus. And so, in the case of somebody who, is actually a COVID positive, they've been tested, or they are, highly suspicious of having the virus. Once they've recovered and symptoms have subsided, we can be reasonably sure that they are no longer contagious.
It seems like people are only being admitted into the hospital if they have very severe symptoms at this point because of the outbreak. What would you say is kind of, if you have a fever for a number of days. Is there a number of days over like 101 or 100 or whatever as an adult that you should be more concerned?
It's so individual based on someone's,
right.
age, their underlying
right.
medical conditions. And so the best thing to do if you're not feeling well is to call your doctor, is to seek medical care. It's just, we know that, that people over the age of 60 tend to have more serious illness and higher rates of death in the setting of COVID-19. People with underlying medical problems, whether it's kidney disease, lung disease, heart disease, diabetes, or even long-term smokers are at higher risk of illness and death from this. And so, each individual person has to be taken on a context-specific basis and evaluated for their potential risk.
Actually, which reminds me, so you are also the founder of NWell and trying to change the conversation around end of life issues. And unfortunately, with this pandemic, we're going to see a lot of that. Are there conversations that you think families should be having, or, whether they're ill or not? Because we're in the middle of this.
Yeah, thanks for asking that. I do think that we're going to see a lot. Well, we already are seeing a lot of illness and a lot of death related to COVID-19. I think that it's important, no matter what, to, share your own personal wishes if you are to become seriously ill with the people that you love, and have a conversation about it, whether or not COVID is happening. And, it's, I think the important thing to recognize is that the U.S. healthcare system, again, regardless of COVID, but, especially now, is set up to provide pretty aggressive and invasive treatment, no matter how old you are and no matter how sick you are. You're under medical condition. And what that means is that, if you are to become seriously ill,
sorry, Shoshana, can you repeat back a little bit? You started.
Yeah, sorry. I guess I'm having some. I don't know. Maybe it's the internet service provider in San Francisco here. I don't know what's going on.
But to shut down everything.
Yeah. Can you hear me now?
Yeah.
Okay. Yeah. So, regardless of your underlying medical conditions and your age, you will get aggressive invasive treatment, and that is often takes place in the ICU with placing a sturdy plastic tube down your throat to breathe for you and put you on a machine to help your lungs work. If your kidneys fail, using large IVs to filter your blood for you through a dialysis machine. So things that are very very invasive, and you'll get that kind of treatment unless you opt out of that and have somebody advocating for you, or you're able to advocate for yourself in those moments to say, hang on, I don't know if I want that, or tell me more about what this means and what the future may hold for me if I do go down this route. The healthcare system isn't really set up to be having those nuanced conversations about the pros and cons of each individual medical treatment and whether it makes sense for somebody. We're definitely not set up to be focused on quality of life. We're much more geared toward quantity of life, no matter what that life looks like. And frankly, that to me is a huge failure. That we need to be incentivizing, encouraging these conversations between healthcare providers and their patients and families, and also among people and their families, to be talking about these things. I think especially in the setting of COVID, for which we know so much illness and then and death is going to be coming. I think now is it's a really important time to think about, if you are to become sick, who would you want to speak for you? Who knows you the best? And then having a conversation with that person, about what does quality of life mean to you? And if time were short, where would you want to be spending your time ideally? We also know that most hospitals now aren't able to allow family members at the bedside of their loved ones. And so what would that mean to be isolated if you were seriously ill, just surrounded by medical personnel? I think these are all, unfortunately, the reality that we're living in, and things that people really should be thinking about and talking about.
Yeah, no, I think it's an opportunity for families to talk about these issues, right? Because we're all going there. um, and that would be, they would be signing advanced directives, correct? So they would go to the hospital and give the doctor their healthcare proxy and their living will. The living will states what kind of treatment they do or do not want. Is that right?
The advanced directive portion would, and there's a bunch of websites and places that people can go to find more information about their states in terms of the legal advanced directive documents. But honestly, much more important than a document is the conversation. So if you can't get your hands on a piece of paper or you can't find it, making absolutely sure that your personal wishes and values are conveyed to the people that you love, and then telling your sister or your mother or your cousin or whomever it is, your friend, that you want them to be your healthcare advocate, your proxy. If you are to become sick, here's what I value the most. Here are the trade-offs I'm willing to make for a chance to get better. Here's what I'm not willing to do. And I think those kinds of conversations are critical right now. I personally like the 5 wishes document as a living will or advanced directive. And there's card. Yeah, the 5 wishes. Oh, it's basically a document like an ethical will that touches on various things around end of life, around legacy, around funeral planning. It just asks things in a really beautiful, thoughtful way, different than a traditional advanced directive document. But, the conversation project is also wonderful. Card games like Hello or Go Wish can be helpful for families to play in terms of coming up with what are the right questions to be asking. How do we prioritize, goals and values if you are to become seriously ill or near the end of your life. Those are really wonderful. Cake is an online platform that you can pretty quickly and easily fill out an advanced directive. But again, more important than the documents is the conversation. Thinking about it first, reflecting, and then talking with the people that you love about what matters to you.
That's great. I'll put those links down in the description below after this. So, you worked in a hospital setting. And it might be hospital by hospital, but if someone is in ICU and they cannot see them, like family members can't see them, is the only way to get in contact with them is the doctor? Like, how do they communicate with the patient, with their family member?
Yeah, great question. I know there's a lot of institutions working on this, how to improve communication now that, physical distancing is really the norm. For families, obviously through a cell phone, if somebody has access to that and using video chat, if somebody's intubated or sedated, it's much harder, right, to get through to them or to know if they're hearing you or seeing you, right, if they're not awake. But yeah, I think each individual hospital has their own policies around if someone can be in the room and for how long, and how to best communicate. So I'd recommend that folks reach out directly to that particular institution to find out.
And one more question. So I don't know if you would know the answer to this, but do you know, well, maybe you can only speak to California. Is there like state to state coordination? I feel like a lot of the states are kind of left on their own at the moment to handle their crisis. Do you know, is there any kind of coordination happening nationwide or amongst other states, or on how to
coordination in terms of regulation, or
on just how to, whether it's no, I don't know if it's necessarily regulation, but more like procedures and just kind of helping each other out.
Yeah. The policy stuff is way outside of my area of expertise, but what I can tell you just from myself watching the news, I have heard that the governors, so state governors, do get on a phone call every now and again to talk about what's happening in their states, best practices in terms of what's working, how to coordinate efforts. So my understanding is there is some of that happening. And then, of course, in the private sector, there's tons of collaboration across states and companies and countries in terms of sharing sharing data, sharing the latest science about what's going on. I think one thing that's been really beautiful is just how much the scientific community is willing to work with one another to come up with solutions, to share the evidence of, and the data of what's happened in Asia and Europe, so that other people can be better prepared. So I do see this wonderful spirit of people wanting to help. And then similarly with companies that are making products, whether it's masks or ventilators or 3D printing, things that people need, there's just been an outpouring of support. So on the positive side, it's been a really beautiful show of of humanity coming together around a real crisis.
And how about you doctors and nurses, and how are you guys coordinating? I just feel like everything is just such in panic mode that maybe hospital ERs are kind of more trained for this sort of thing, to be in kind of triage mode, but
not really, not to this scale, unfortunately. I mean, as you probably know, many places have run out of masks, of face shields, of gowns to keep people safe. So we've been woefully, underprepared for all of this, unfortunately, and put a lot of our healthcare workers' lives at risk, and their families as well, which impacts everybody, of course. I think each individual hospital, medical institution is just trying to take it day by day and do their very, very best to care for people. I think a lot of doctors and nurses and respiratory therapists and people on the front lines are taking to social media to communicate with one another and to talk about what their individual hospitals are doing, and sharing resources and thinking about it. And so that's also been wonderful, and a real blessing of social media in this dark time, is that people can connect. And I hope that continues.
And so actually, speaking of social media, so what is your Instagram handle? Because you are taking questions on a daily basis, or I guess every few days?
Trying to on a daily basis. Yeah. And then go live or create videos to answer them. So my Instagram name is Shoshana.
Oh God, hold on. Say that one more time. Sorry, you froze again.
Yeah. It's Shoshtagram. SHOSHSTAGRAM.
And we will put that in the description below. So as we wrap this up, Shoshana, is there any kind of, I don't know, last words of advice or kind of thoughts that you've had that have kind of been on your mind in terms of sharing with folks as they kind of navigate these unknown waters?
Oh man, just be kind to yourself, be kind to others. Right now, we really truly are in this together, and the actions that we take today absolutely matter. This is on all of us to really take this seriously, to pay attention, and hopefully, by staying home now, we can prevent sort of worsening of this crisis.
Thank you so much, Shoshana, and best of luck with you and all your patients. Stay safe and healthy, and
thank you.
And we'll be in touch. Thank you.
Okay. All right. Take care.